Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and we're very excited about today's episode because it's an episode that you guys have demonstrated that you love. Why? Because we see the downloads, and it appears that Q&As, question and answers, is a very popular topic, and understandably, it's because you get to hear your questions and then you get them answered. So, we're joined by Maria, the producer, and we're going to go through all of your questions. I want you to listen up and carefully. I have to tell you, and I do this every time, the questions are just getting better and better. I remember we started this podcast 5 years ago, and the questions sucked. I mean, we would get, let's say, 100 questions, and I would only want to answer like 8 of them because they were just not relevant questions. But the questions get better and better, which makes me excited because it means that the global plastic surgery community is getting savvier and they know the lingo and they're doing more homework. So right on. Let's dive in, Maria, and see what we got.
Okay, so we're going to start with faces.
Faces it is.
Okay, from Tex-Bex.
Tex-Bex? All right, what is it?
Is the Eve lift the same as a facelift?
So is it called the Eve lift?
Yes.
Okay, so I want you to listen very carefully because this is really important. 99% of face lifts, neck lifts, are the same. The same caca. They're all the same. Principally, they're all more or less the same, and I'm going to explain to you what the basic principles are. The difference is that as surgeons, we love and need to be marketing experts. So what we need to do is tomorrow, I'm going to take a facelift. I'm going to do something totally esoteric. I don't know. For example, take a stitch and go from here to there, and then I'm going to call it the Rahban lift. It's the Rahban lift, or we're on Lasky. We'll call it the Lasky lift. And you as a patient is like, what the fuck is a Lasky lift? And so it creates a sense of allure, and then I write that I developed it and whatever. Facelifting was designed and was discovered and advanced many, many years ago. The basic principles of facelifting is, number one, as I've said many, many times, 9 out of 10 parts of the facelift are addressed to address the neck skin, neck bands, jowls, marionettes. Now, they also help address the mid-face or the face part, but most of the power is in the neck and jawline. Then, depending on the techniques, in addition to doing something to the skin, surgeons are going to do something to the muscle layer. That's the advanced part. You know, they used to many, many years to do what's called a skin only, where you just lift up the skin and pull it. And we realized that was not very good because what's sagging is the muscles and the skin. So we have developed many advanced techniques as to how to address that muscle layer. And so whether people go underneath the muscle layer and elevate it, called a deep plane or dual plane, whether they plicate it, meaning they suture it, whether they take a part of it out, whether they go really low, go high, all that is nuanced space. But as far as you guys are concerned, they're almost all the same shit. So yeah, I don't know an Eve lift or an Eva lift or a nighttime lift or whatever they're called, but by and large, it's just marketing.
Okay, so this one comes from T Majors.
T Majors.
Do you need fat grafting with the facelift?
So fat grafting is something that is an interesting topic. It's like one of those things that if done correctly, it's really great. If done incorrectly, it's very terrible. I guess that's the case with most things. And here's the skinny. Years and years ago, when fat grafting wasn't really a subject matter or concept, when you would do a facelift, you would basically take what's there and pull it and lift it and rejuvenate it in that regard. And obviously, patients looked better. But the issue was that if you were hollow, then you didn't really fix the hollow, did you? You just pulled it. And we realized that when we age, just if you were 30, then 40, then 50, then 60, what is actually happening is, yes, you're getting sagging of the skin, but you are also getting hollowing of the face. You're actually losing subcutaneous fat. So if you look at pictures of my son, who's 3, he's fat and cheeky, and when he turns 20, he'll have less fat, and when he turns 70, he'll have less fat. So if you want to truly rejuvenate a face, and by the way, every face is different. There are people who are like 70 who still have full faces, A, because that's their genetic, and B, because they're overweight. But if there is also concomitant hollowing, then yes, for you to look your very best, you need to elevate and re-suspend the face. And in key areas like the mid-face.
And how about the temples?
The temples are one of them that
Because
hollow.
I noticed that in me.
Right.
The temples kind of get...
Correct.
Which I never noticed.
So if you look at your grandmother, your grandfather, and you really critically look at them, yes, they have all this loose skin, but there are going to be areas that have super hollowed out. And it's usually like the temples, the mid-face, right? Their lips, et cetera, et cetera. So the answer is, in most instances, some selective fat transferring is ideal.
I went through weight loss. So I've always had a chubby face. And I was looking at pictures the other day, and I know, well, I've lost weight, so I'm skinnier here, but I still have the chipmunk cheeks.
Right. And the reason
that doesn't go away.
And the reason it doesn't go away is because that's bone. If you actually touch your mid-face, you have beautiful cheekbones. So there are individuals who are anorexic, and they've lost most of their fat, yet they still have cheeks, and those cheeks in those instances are cheekbones. When you don't have the luxury, because it is a luxury, of good cheekbones, then when you start to get hollow from the weight loss, you get gaunt. So you're blessed in that regard. So cheeks are they're $1 million cheeks.
I feel like I look like a chipmunk. But
well, yeah, everybody hates a thing that's their greatest asset.
So one of my favorite topics, because I see it all over the place, are the eyebrow lifts.
Sure.
It's one of the. So this is from K. Favodian.
K. Favodian.
Ask if eyebrow lifts can be done with small surgery.
So why eyebrow lifts are popular is because as people are getting more and more savvy, we have more and more social media, the more refined aspects of facial rejuvenation are becoming popular, right? Lip lifts, right? Brow lifts. People never really paid attention to that stuff. It was just like you went in for a facelift and you came out looking fresh. They just called everything a facelift. But the reality is each area, your earlobes, your lips, the corner of your lips, the nostrils, every area has its own anatomy. So brows are no different. And when you age, your brows will sag. Not may sag, will sag. And the question is how much and what parts. So most people, the outer or the outer third or the tail of the brow tends to start sagging and starts to create what we call hooding. It's starting to cover the corner of the eye. Those, when that starts happening, patients are almost always like, look at how much my eyelid skin is excess and I have all this eyelid skin, and they're mislabeling some of their eyelid excess as, some of their brow excess as eyelid excess. And the eyelids always get blamed. Whereas if you look at a 45-year-old, for sure the brows are contributing. I mean, you just pull up the corner of the brow with your finger and you're like, oh, holy shit, that looks so much better. So as a result, when I do upper eyelid skin, I would say 80% of the time, I'm doing something to the brow. If what you need is just the tail, the outer third, again, I said most people, then yes, that surgery can be done from a very limited incision in the hairline, within your hair, say the size of an inch or so. And there are various ways of doing it. There are individuals whose brows sag totally, meaning the whole sag, which is the whole forehead, and the whole forehead drops across the entirety. That then requires a bit of a more aggressive or more complete surgery. And the way I do it is I do a complete brow lift where I go into the hairline and lift the whole brow, opening up the root of the nose because they get that line across, etc. So yes, depending on what type of brow lift you need, it certainly can, in most instances, is done through something limited.
Okay, so here's a question from Rebecca, 6809. Can fat be transferred to the jawline for more definition?
So here's yet another question on fat, which is, hey, can we use fat for? Because usually it's, hey, can I use fat for my cheeks? Hey, can I use fat for under my eyes? Hey, can I use it for my lips? So this question is, can I use it for my jawline to create more definition? The answer is yes and no. The reason it's yes and no is a little bit of fat may help, but fat is mushy. It's
just like when you use fillers, you don't recommend it, right?
So fat is mushy. So fat should be replacing mushy stuff, right? Your temples are soft. You're actually losing fat, so replacing like with like is a great idea, right? Your cheeks are fat, with the exception of your bone. So when you lose cheek volume, it's natural to replace soft with soft. But often what's causing the obliteration of your jawline is A, you're getting skin that's sagging down and starting to duplicate the jowl, the marionette. And B, you get a little bit of bone loss. So to replace hard bone and with soft doesn't often work as well. You need something rigid to replace rigidness. What makes a jaw attractive versus a cheek is it's something skeletonized and sharp and catches a light. So you can use fat a little bit, but it's certainly not the ideal way to go. And if you put a lot of it, then you get just a fat neck.
Yeah, you don't want a fat neck.
Nah.
Okay, so let's now move on to abdominal.
Okay, we're moving on to the abdomen. What do we got?
Okay. Do you team up with general surgeon when hernia is complex?
Never. No, I'm just kidding.
Oh.
So do I team up with general surgeons when the hernia portion, was it hernia?
Yes.
Hernia portion is complex. The answer is yes, but there's a caveat.
Okay.
My area of expertise, I do the whole gamut, but I've sort of over the last 20 years, certain areas I've sort of subspecialized. So abdominoplasties, DR, diastasis, hernias is my bread and butter. So I'm doing hernias and DR that most people would never do, and I see people from around the country. And so naturally, they're seeing surgeons in their cities, and plastic surgeons are like, oh no, I'm not going to touch this. You need to go to a general surgeon, have your hernia fixed, whatever. So I have historically repaired 99% of the hernias on my own. If the hernia is in the midline, meaning in the middle of your abdomen, aka coming through your diastasis, which most of them are, I've repaired some that are the size of a softball.
Wow.
If your hernia is in your groin, if your hernia is on the side, then that's a different story. So I have worked very closely with general surgeons, and if need be, certainly I will team up with an OBGYN, with a general surgeon, with an ENT. But this particular area, I am doing some high-level stuff on my own because it's an area of my expertise. And by the way, all of it without mesh. Never, 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 never have I ever placed mesh ever in a hernia in the midline.
Yeah. Well, there's a question here from Hallie Dari.
Hallie Dari.
Is tummy tuck work possible if hernia repair has been done?
So the question is tummy tuck work possible if hernia work has been done? The answer is yes. So a lot of patients are like, listen, I had this umbilical hernia after my second pregnancy. It was bothering me. I had it fixed. And then I had 2 more kids, or I had another kid, or what have you. And now I'm here. And the answer is, okay, no problem. So I'm going to go through, do your abdominoplasty. If the hernia is fully corrected, then we leave it alone. If the hernia, which many times is inadequately corrected because the diastasis was never corrected, then I'll repair it the second time the correct way. So let me explain that to you understand. Hernias that occur in the midline, right through the middle of your abdomen, because the muscles have pulled apart, do so because that material is very, very thin. That tissue is thin. So it comes through, and then your surgeon is going to go and put some stitches in it, and is going to put a piece of mesh in it or whatever. But remember, the foundation is still shitty tissue. So unless the muscles are brought together, unless the garage door is closed, it is not uncommon for hernias to recur. So even if you had your hernia repaired through your midline and then I come to do your tummy tuck, more times than not, I have to reinforce it. So yes.
Okay, this question comes from Nadine MCX.
Nadine MCX.
How do you know if you're a candidate for body lift as opposed to a tummy tuck?
That's actually an excellent question.
Yeah, I was wondering that too.
So all we're doing is being a tailor or a seamstress. As the amount of loose skin increases, so does the length of the scar. I want you to understand this. This is the whole principle of a dog ear, and I've talked about it many times. All a dog ear is redundancy, leftover tissue that didn't get cut out. So if you have a tummy tuck and you remove a lot in the middle, and then you make a tiny little short scar, then the wave of skin on the outer part doesn't get cut out and you get a leftover. So principally, doesn't matter who your surgeon is, there's no magical technique that a surgeon can overcome geometry. As the patient has more skin, I need to make the incision longer. So if your skin is medium or moderate, because you've had 3 kids, then you can get away with a tummy tuck, and sometimes your skin is so much that I have to go to the end of your hip, which I call an extended tummy tuck. But if you have a lot of loose skin, either because your kids were very damaging, whether you lost a ton of weight, and after I go to your hips, there's still redundancy, then what do we need to do? We need to go around the corner. We need to remove the redundancy. And then I go from a tummy tuck to an extended tummy tuck to a 2/3 body lift, which means I'm 2/3 of the way there, to a full body lift.
But you would know before.
Of course you know before, because you and your surgeon should be going, look how much skin there is. And they should be showing you like, look, if I end here, there's this extra skin on the side here.
There was one case of a girl who had lost some weight. No, that she had a baby and she wanted to do the mommy makeover. And you had told her, I recommend you do a full body lift because she had lost weight. And when you looked at her, you said, I recommend a full body. And she was upset at that. And I think she started working out and building muscles, whatever. And I think it got better. She was young.
It doesn't get better.
Right.
You can work out till you're blue in the face. It only gets worse.
Right.
And once you have redundant skin, unless you gain a ton of weight, like you're always going to have redundant skin.
Right.
So
unless you build muscle, right?
No, even if you build muscle, but muscle doesn't do anything. Muscle just makes you fit. Muscle doesn't make skin tight. That is the biggest misleading statement that is used by the entire athletic community to get patients to stay on track. As one gets leaner, I don't care if it's through starvation, gastric bypass, working out 7 days a week. Yes, as you build muscle mass, you will build volume through muscle that will stretch out the skin, but it's not going to make the skin tight.
Right.
You're only going to lose more body fat. Your skin actually remains loose. You just look a little bit better. But no amount of working out is going to make skin that's loose and stretchy tight. Nothing makes the skin tight other than gaining a boatload of weight. So the reason why it works with muscle gain is if you gain a lot of muscle, you're actually getting bigger, therefore filling in the envelope.
Right.
But the reality is if you grab the skin, it's still loose.
Right.
So at any rate, that's the key to figuring out if you need a tummy tuck, an extended tummy tuck, a 2/3 body lift, or a body lift.
Okay, this question is from Mona Kalik.
Mona Kalik.
My flank skin became loose after lipo and tummy tuck.
Oh my God, couldn't have been a better question.
What can I do to make it tight and smooth?
Oh my God, what a perfect lob. Maria, great choice. So here we have it.
I create the flow.
Yes, I like that. So here we have it. A perfect example. Perfect. It can't get any better than this. A patient goes and gets a tummy tuck. I guarantee you, preoperatively, she had some fullness in her love handles. And her surgeon told her what 99.9% of surgeons tell you. You need a tummy tuck and lipo. Patients love the idea because they love the sound of lipo, which just means lose fat, I get skinny. They just love it. Patients love liposuction. And then that area, because she was a mom probably, had some loose skin, was liposuction. Time went by, because it always takes about 18 months to 2 years. And then what do you know? The flank areas now become a little loose and shitty and the skin is soft. And now you have this tight abdomen in this loose area where you had liposuction. So what's the answer, everybody?
No liposuction.
Besides, what do we do with that loose skin? We have to cut it out. The end. Yeah. So now, because of the liposuction, because of the fact that you worked out, because you had 7 kids, you have loose skin. I don't care how you get there. I have this loose skin. It's in my flanks. I have to take the tummy tuck and extend it around the corner and remove the loose skin that has been generated from the liposuction. That is why maybe 1 out of every 20 or 30 tummy tucks I do, I liposuction. Because I'd rather you, who's a 35-year-old, 45-year-old woman, have a little bit of fullness and still some turgor, tightness, than for me to lipo it. It's gone now, and then now within 2 years, guaranteed have some loosey, floppy skin. So that was a perfect segue to this whole concept.
Well, and if there's a lesson to be learned, avoid liposuction whenever possible. That is the biggest lesson.
The lesson to be learned, because I get so much heat from other surgeons. Remember, liposuction is the #1 procedure done in America. Okay? Above breast aug. So that's a lot of surgeons doing a lot of liposuction. So when I make these statements, they're like, this was irresponsible, you're scaring people. Here's the true statement. Do whatever the hell you want to do.
Yeah.
Understand that despite the type of liposuction, slim lipo, laser lipo, vaser, heat, blah, 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 when fat is removed, you will excavate that area in many instances, not all instances, not every patient, but in many instances, you're left with loose skin, some irregularities, dents, and divots. If that's okay to you, if that exchange is okay to you, or the risk of that being possible is okay to you, then knock yourself out. I, as a surgeon, don't like that look and don't like that risk. So I advise my patients against it. I make a living. I don't need the liposuction. I don't care. I'll do it when it's a unique instance. But I'm not saying that you should never do liposuction. Right. I'm just saying, know that if you go in the water, you're going to get wet.
Yeah, whenever you can avoid it, avoid it.
So that's that.
Well, that's it for our questions for today.
All right. Well, that was actually a very good set of questions. Yeah. I'm impressed. Yeah. All right, guys. Well, that wraps up this episode of Plastic Surgery Uncensored Q&A. As always, number one, thank you for these questions. They were excellent. Number two, if you like our show, if you love our show, do two things. One, share it with people. We live off of the progress and the sharing of this content. And then go write something nice. When we go online and we go and look, oh my God, we got like 2 people wrote nice things. It really makes coming here, we're obviously here on our off time, so much more enjoyable and tolerable. So until next week, I'm your host, Dr. Rady Rahban, and we'll see you on Plastic Surgery Uncensored.